Hey there, my name is Myles Nobles. I'm a first year graduate student at the University of the District of Columbia Speech and Language Pathology program. Today I will be presenting my portfolio, while my client for confidentiality reasons will be presented as EB through my summer semester of Clinic Level 1. So this is my portfolio. I titled it Myles Nobles Clinical Chronicles. In this portfolio will be reports, resources, and other documents that have been a part of my clinical journey thus far with my client, EB. Thank you for your time and looking at my portfolio in advance. This page documents steps taken on a journey of treatment of a young boy who has autism spectrum disorder, a receptive language deficit, and an expressive language disorder. This journey has impacted me in many positive ways and looking at the perspective of the clinical world in a different light. So let's meet EB. So EB, he's a 4-year, 9-month-old African-American male. He was assessed at the Kennedy Krieger Institute by a multidisciplinary team. His performance revealed that EB met the criteria for autism spectrum disorder. His deficits were in receptive and expressive language, particularly with social interactions and communicative intent. He received individual speech and language services at the Kennedy Krieger Institute from April 6, 2015 through June 30, 2015. Services were delayed at the time due to family requests. EB attended preschool at Jackson Road Elementary, where he received group therapy services. He was also assessed formal and informal tests at the Kennedy Krieger Institute. Everything, for the most part, came out normal except for the language portion. And Ethan was administered the preschool language scale 5th edition, also known as the PLS 5. This assessment primarily assesses auditory comprehension and expressive communication. EB had a raw score of 16 and an age equivalent of 11 months in expressive language. Okay. So for treatment history, EB attended therapy at the University of the District of Columbia Speech and Hearing Clinic during the spring 2016 semester. The privileged clinician made a first, then visual reinforcement schedule to help EB verbally express the activity he wanted to participate in. Parental training and engagement was facilitated by EB's mother to sit in on therapy sessions. This was helpful in practicing therapy techniques during the session so that EB's mother can incorporate these techniques at home. EB made progress with his previous expressive language and attention goals and objectives. He was also improving in his ability to follow one-step directions. He followed simple directions with prompts and cues and sometimes in need of incentives. For the treatment methods that the previous clinician used was play-based therapy, client-centered therapy, picture exchange communication systems, also known as PECS, and symbolic play. All right, so diagnosis. EB presents with autism spectrum disorder, receptive language deficit, and expressive language disorder. Before going into the therapy room with EB, I had to prep myself on the deficits that he presents with in disorders. To help me with autism, this chart gave me really great insight. It brought knowledge of awareness of characteristics that EB may possess and execute in the treatment room. It helped me as a student clinician to prepare and to know procure compensatory strategies if needed to use during treatment with him. One that stood out a great deal throughout treatment with EB was avoiding eye contact. He had difficulty with this, especially at looking at me as well as throughout the activities we had. So I had to really redirect him a lot through visual and verbal prompts. The expressive language disorder chart, it was very helpful. This chart was helpful in determining where EB struggled in speech and language according to his age. Being familiar with these characteristics of an expressive language disorder made it easier to determine specific areas that needed to be targeted. Also, developmental language milestones from birth to 5 years old. This handout, it was it was very helpful in determining again where EB struggled in speech and language according to his age. Being familiar with milestones made it easier to determine specific areas of receptive language that needed to be targeted for treatment. Okay, so for my evidence-based practice on joint attention, I found a very interesting article titled Joint Attention in Early Language. In this article, it gave me great insight and justification on why I'm focusing on joint attention and eye gaze with EB. It's important to work on eye gaze during conversational speech and joint attention. The use of gestures and gaze between two people emphasize and share attention on objects and events that will be utilized. According to Ratner and Bruner, joint action routines is the framework for the development and acquiring communication and language. Due to the formulated and rule-governed routines incorporated within JAR, joint action routines, language acquisition is facilitated through a set of familiar semantic meanings and utterances. So following now in my portfolio, you will see that I had my initial session plans as well as my session intervention plans, also known as SIPs. Then my SOAP notes, which are summaries of how EB performed during this session, and then my reflections on what I gained throughout the sessions with EB. I made a visual schedule for EB, again, the first and then now schedule. Here you can see first we do an activity, like the puzzle activity. Then if he cooperates and does the activity, we go to playing with the cash register for a few minutes. The purpose of this visual schedule is to give EB structure on how the therapy session would go and what expectations were for him during the session. He would be rewarded if he cooperated and participated during the session with play. My next artifact is alphabet puzzles. The alphabet puzzles were one of EB's favorite activities that he enjoyed. From the first session I had with him, I observed that he liked letters. I made sure to incorporate this into the treatment to keep him attentive and on task. Here are some more of my sips, soaps, reflections. Okay, now for his treatment plan. Okay, so for my baseline data with him, I I focused on joint attention, 2 to 3 word phrases, and following one-step directions. So Ethan demonstrated joint attention through eye gaze for at least 5 times towards the clinician with 0% accuracy during the baseline session. ED verbalized 2 to 3 word phrases and requesting items for activity verbally when presented with 3 choices with 0% accuracy during baseline. And my last was EB will follow one-step directions given by clinician accompanied by no more. And he received 70% accuracy on that. So since he did not meet mastery of these Objectives during baseline, I put these as my short-term goals. But first, I would like to go into my long-term objectives. So for my long-term objectives, I said EB will maintain joint attention by either initiating, engaging, or using eye gaze with minimal verbal prompting from the clinician. Ethan will verbalize 2 to 3 word phrases and requesting items with minimal verbal prompting from the clinician. Ethan will follow one-step directions with minimal verbal prompting from the clinician. For my short-term objectives, Ethan will demonstrate joint attention through eye gaze for at least 5 times towards the clinician, accompanied by no more than 2 verbal prompts with 80% accuracy. EB will use 2 to 3 word phrases to request items or activity verbally when presented with 3 choices from the clinician, accompanied by no more than 2 verbal prompts within 8 out of 10 trials. EB will follow one-step direction given by clinician, accompanied by no more than 2 verbal prompts with 80% accuracy. So for my procedures and materials, EB will receive individual 60-minute speech and language therapy services once a week at the University of the District of Columbia Speech and Hearing Clinic. The clinician will use preferred activities and will engage in play-based and focused stimulation therapy. The play-based therapy method will be used to get EB to engage in eye gaze, produce 2 to 3 word phrases, and follow one-step directions. Implementing direct elicitation of child language within the context of child-initiated activities is the most effective strategy, I feel, for producing short-term gains. The clinician will also use verbal and/or visual prompts as necessary. Focused simulation activities will be incorporated in therapy to help target certain phrases EB will be working on as well. Therapy activities will include relevant functional tasks that focus on demonstrating eye gaze, producing 2 to 3 word phrases, and following one-step directions. Materials used will include puzzles, slides, balls, Play-Doh, toy cash register, Mr. Potato Head, and the iPad. Supports provided will include visual and verbal prompting. A visual schedule will be present during each session to keep EB on task. Reinforcements for responses will include high fives, verbal praise, play with the toy cash register and iPad for its efforts. EB will receive homework throughout the semester, and the caregiver will observe throughout the sessions. And here are some more of my tips, soaps, reflections throughout the semester. So this is EB's progress report. And this pretty much just goes over how much he progressed from the beginning of therapy this semester to the end. And I'm just going to go over the objectives that I had for him, the short-term objectives, and his progress by the end of the semester. So the first short-term objective is EB will demonstrate joint attention through eye gaze for at least 5 times towards the clinician, accompanied by no more than 2 verbal prompts with 80% accuracy. By the last session, he achieved 40% accuracy, meaning that this goal is still in progress. The second short-term objective, EB will verbalize 2 to 3 word phrases and requesting items or activity verbally when presenting with 3 choices from the clinician, accompanied by no more than 2 verbal prompts within 8 out of 10 trials. By the last session, he achieved 7 out of 10 trials, meaning that this objective as well is in progress. The last short-term objective that I had for him, EB will follow one-step directions given by clinician, accompanied by no more than 2 verbal prompts with 80% accuracy. By the last session, he achieved 10% accuracy because previously he did not attend therapy prior to the last therapy session because he was ill. So I had to reprogram him, and I had to redirect him a lot through visual and verbal prompts, and he just didn't want to cooperate by the time it came to the last activity. So my recommendations for the next student clinician that works with EB is that to consider highly motivating activities, including puzzles, slides, balls, Play-Doh, toy cash register, Mr. Potato Head, and the iPad to increase his engagement during treatment. Also to increase emphasis of carryover and generalization of skills practice and treatment for improved functional communication once he's outside of the therapy room. And my last artifact that I would like to share is a scene from Facing the Giants movie, the death crawl scene. And I just wanted to say that this was presented to me during my first week of didactics with Professor Spivey, and it really spoke volumes to me through reflection and how much I've gone through this whole year of graduate school, and just to dig deep and to never give up. And that what I'm going through now is just going to make me a stronger person and a stronger speech language pathologist. So I just wanted to thank you guys again for taking time to look at my portfolio. I hope you enjoy.